Welcome back to NTV Weekend Edition. It's great to be back after a long sabbatical from COVID-19 millionaires, and a lot of people expecting really to get a lot from tonight's discussion. I'm not always the bearer of bad news. Short of hope, let's talk about vaccination. We are still trying to adjust to what we called a new normal last year. It has been rough for many who have either lost jobs, businesses, or loved ones. We are still dealing with the staggering figures globally when it comes to the spread of the virus. The whole world is pushing to get the COVID-19 pandemic under control. The country has lost many lives. Many more are in hospitals across the counties, and the restrictions have pushed many to the edges of uncertainty, with a big population yet to be vaccinated. The total caseload, as Zainab earlier mentioned, in Kenya now stands at 138,988. The latest figures of those who have died stands at 2,224. Unfortunately, there's little sign that these numbers are going down anytime soon. A lot to unpack in this year's first NTV virtual town hall on the vaccination program. Let us deal with the facts and the fears, the myths, to help us push the conversation forward. I'm now joined by Dr. Willis Akwale, who's chair COVID-19 Vaccine Deployment Task Force. We also have Dr. Githinji Gitai, who's the Group CEO, Amref Health Africa, and also Lynette Kamadi, the Executive Secretary, Kupet Mombasa, joins us from our Mombasa studios. And last but not least, Celestine Lagat, a business lady in Eldoret, joins us from her home. And just to point out that all of our panelists are joining us from home. And of course, we have you as the viewer to join this conversation. It's very, very easy. Use the hashtag #ShortOfHope at NTV Kenya, at Dennis Okari on Twitter. Now, we received your questions via WhatsApp, and shortly I will direct them to the doctors. But first things first, ladies and gentlemen, many thanks for your time and for joining us. And I think I'll start with the two doctors, and maybe Dr. Willis. Have you been vaccinated? Well, sounds a pretty obvious question. Have you been vaccinated?
Yes, I was vaccinated on the 9th of March at Mutuini Sub-County Hospital in Dagoretti North.
Any side effects? Fatigue, diarrhea, fever?
No, just a little bit of numbness of the arm, a little bit feeling heavy on the second day, and after that I was as fresh as I could imagine.
Okay, great, Dr. Ari. Dr. Githinji Gitai, who's the Group CEO, Amref Health Africa. Have you been vaccinated?
Yes, Dennis, I was vaccinated on the first day when we were launching the country's vaccination program at Kenyatta National Hospital. And I have been fine. I actually had minimal pain on the site of injection. I didn't experience a fever. I didn't experience any extreme fatigue. So I have been fine since then. Okay. I'm waiting for my second one at the end of April.
Okay, both doctors and for our viewers, just for purposes of clarity, I haven't been vaccinated yet. I'm not a very big fan of jabs. I will at some point. Lynette Kamadi, have you been vaccinated?
No, I have not been vaccinated. Initially, I thought you just walk into a facility and you are vaccinated. Only to arrive and I was told there is protocol to be followed. You are supposed to fill a form and submit it, and you are given time when you are supposed to go for the jab. So I'm due for my jab on Tuesday.
I know, Lynette, you have a lot of concerns. We will break those down. Let me first go quickly to Celestine, who is in Eldoret. Celestine, have you been vaccinated?
Not yet. I have not been vaccinated.
Have you tried getting that vaccination?
Yes, but I don't fall in the category of those who are eligible for now, above 58, and the essential workers like the medical personnel and the teachers.
Okay, Celeste.
And most of the centers also, they had run out of the vaccine.
Okay, Celestine, apologies for that. I know we're going to have that short delay each time I'm asking a question and you're responding. We'll just get used to that. I have a very, very short time to break a lot of things down. We have a lot of questions that have come in from our viewers on my Twitter handle at NTV Kenya, at Dennis Okari. And we also had asked you the questions earlier, and some of you have sent in your question via video. But first things first, I want to ask my first question to Dr. Willis. Now, why has Kenya banned the Russian COVID-19 vaccine, Sputnik, when it earlier had approved it for emergency use? Very briefly.
Yeah, thank you, Dennis, for raising that. Let me start by saying that, yes, Sputnik had been given import license by the Pharmacy and Poisons Board. There were certain conditions that needed to be met before its deployment. And there were also rules and regulations and emergency use in which it was deployed that were very categorical, including the fact that you cannot advertise it because it hasn't got market authorization. And also the other key aspect was that any vaccinations have to be conducted in a facility accredited by the Kenya Medical Practitioners and Dentist Council. We got reports of violation, and the Pharmacy Board actually informed the task force that even a warning had been issued. And on Friday, when the National Emergency Response Committee, under the chairmanship of the Cabinet Secretary Mutahi Kagwe, when they met, they reviewed that, and also some other concerns, especially in ensuring that the quality of the vaccination, that the public health interest comes first. So it was deemed necessary to have the ban so that the framework and the infrastructure, a transparent infrastructure that would even ensure monitoring of all vaccines coming to the country in line with global practice are put in place.
Thank you, Dr. Willis. Dr. Githinji, with everything that has been said about, the Russian vaccine and the AstraZeneca vaccine, some EU countries have actually paused the rollout of the AstraZeneca vaccine amid concerns of blood clots and other health complications. Someone has asked a question: why insist on vaccinating Kenyans without addressing quite a number of these concerns? Are we doing this as an experiment?
Thanks, Dennis, and let me take just a few seconds first to explain what this is about. That vaccines have been in use since the 17th century, so they are not new. Secondly, Kenya vaccinates, and many other countries and across the continent, across the world, vaccinate millions of children every year, every day, every month, every week. So it's not new. Now, we know that when vaccines are developed, there are two major issues. First, vaccine development is a very robust process. Starts off with preclinical studies using animals, then moves to phase 1 clinical, where it uses a group of people. All the vaccines have gone through that. Then goes to phase 2, which uses a bigger number of people, maybe up to 1,000 or more, and then goes to phase 3, where it uses tens of thousands of people who participate in the trials. All these have happened in all these vaccines, and they're looking out for two things. One, most importantly, safety of the vaccines. During all the start from the preclinical to phase 3, all side effects are recorded, they are followed up, and they are checked. And then number 2 is the efficacy. Does the vaccine work to boost the immunity in the human being against the intended disease? These two have been checked in all these vaccines. Now, the thing to realize that every vaccine that we give, including the measles for children, BCG for TB, all have side effects. And those side effects can be mild, can be moderate, or can be severe. And the way to monitor them is through monitoring and reporting and checking. Now, what happens with the vaccines, to explain your question directly, is whenever there is somebody who received a vaccine and they are noticed to have a particular side effect, it has to be checked precautionary, because you have to associate to know, is that effect from the vaccine or coincidental? Many of the countries in Europe that stopped this vaccine were precautionary. Nobody has actually been able to link directly the vaccine with the clots. Clots happen largely in Europe. We know they happen in 5 out of 1 million people generally, even without vaccine. The question is there an increased incidence in the people vaccinated? There is still studies going on. That's why some countries returned back to vaccinating. Generally, side effects are there. The question is always, are they related directly to the vaccine? And are they significant to stop the benefits of vaccination over the risk that they may cause? So this is the framework, and all countries go on. Canada is going on. Countries in Europe have reopened. And the advice of Africa CDC in Africa and WHO is that we should continue vaccinating. So Kenya is following science. It's not acting on its own.
Okay, and like they say, science is progressive. But Dr. Willis, just a quick one. What indemnity has Kenya signed with the vaccine providers? And in this particular case, AstraZeneca. We initially dealt with the issue of COVID-19 millionaires last year, you know, with the PPEs and everything else that KEMSA was handling. Are we likely to see another scandal with this vaccine, probably creating vaccine billionaires?
Let me start with the very first one about indemnity. So under the COVAX mechanism, in which Kenya is a member state, Kenya has signed into what they call a no-fault compensation mechanism, which is administered by the COVAX partner coalition of the willing. Under this, if there will be any serious side event, reaction that may require hospitalization, or if there will be any death, and if investigations are done by an independent team to show that that was actually caused by the vaccine, then there will be compensation for that. So that's the indemnity. And that is a crucial point, because even as the private sector gears to bring in vaccines, they must have an indemnity arrangement as well. Now, on the issue of the billionaires, let me really state that we, under the vaccination program, we will be as transparent as it has never been before. We will share figures. It is important for people to actually even know that the current vaccines is a donation. Immediately they came, there were all these negative sentiments and people saying this has happened. That was actually a donation. And it's important for people to know under that mechanism, COVAX is going to support the vaccination of 20% of our population, or 40% of the adult population. So the, earlier in the news we had of 24 million doses. 24 million doses translates to about 12 million adult Kenyans to be vaccinated. So it's not 24 million Kenyans. While the government will procure 11 million doses to vaccinate 10% of overall population, or 20% of the adult population. Over.
All right, Dr. Githinji, very quickly, before I go to our first video question that was sent to us via WhatsApp, and then I'll go later to Lynette to just find out what are the concerns of the teachers with regards to the vaccination program. What happens to those who have already been vaccinated with the Russian vaccine? Can they go for the AstraZeneca vaccine for their second shot?
The science available. The science available, because again, this is progressive evidence. The science available is that if you take your first dose from a particular vaccine, then your second dose should from the same vaccine. You cannot mix two platforms, different vaccines from first dose, second dose. That's the current available science. If anything changes, I'm sure we'll be advised by WHO and other regulatory agencies.
All right, let's go to our first question that was sent to us via video. And this is Paul Nganga coming from Ngong.
What is the scientific position on the specific antibodies that come with the vaccine versus the non-specific antibodies that the people who have survived corona have? We are told that there are differences between these two antibodies.
Either of the doctors, you can answer that, Dr. Willis or Dr. Githinji.
Yeah, let me say something about Sputnik and then ask Dr. Githinji to answer the issue of the antibodies. Now, by the time the ban was issued by Cabinet Secretary on Friday, there were 527 people who had received Sputnik and were captured in the Chanjo Kenya system. So the plan is that for those 527 people, their second dose will be reserved. Outside that, if you are vaccinated and you are never captured in that system, then it will be too bad.
All right, thank you, Dr.
Githinji?
Well, let us not go into this. a public show. So I would prefer that we don't go into memory cells and IgG and all those things. I'd rather we don't do that. Let us just understand the following: that your body, when you get a disease, let's start with a disease, your body prepares immunity, which is what we call antibodies. Those are produced to be specific to the offending virus or the offending bacteria. And what we mean by antibodies is that these are ammunition, bullets or guns that your body can use in future if the same disease comes. Many of the people listening and watching us now know about chickenpox. That when we were young, you're told if you get chickenpox once, you cannot get it again, because when you get it once, your body prepares enough antibodies for any future attack by the chickenpox virus. But not all diseases are like chickenpox and therefore give a very specific and strong and long-term and lasting response in your body. Some need to be boosted and assisted. Now, when we are doing that, the body does produce antibodies, but also produces memory cells. Memory cells are cells in your body that actually keep memory, almost like a computer, and say, this is how we produced these antibodies last time. So that if it comes again, then we know what to do and quickly. It's almost like doing a drill. I'll explain to some people recently that vaccination is like saying there's a bully who is going to come and beat you, and you know they're going to come. You then talk to your neighbors and your family and say, this is the photo of this bully, recognize the bully, so that when the bully comes and you see the bully at the gate, you can then protect me. So when the bully comes, the neighbors know the bully, your family knows the bully, they protect you. That is basically what vaccination is. We are teaching your body to recognize the potential bully, in this case, coronavirus that causes COVID-19. Let's just leave it there without going into the depth of antibodies and the specific and non-specific antibodies, because I don't think we have time and the science and the audience for that right now.
Well, thank you. Thank you so much, Gidenji. I think you've read my mind. You've schooled us to go back to biology in Form 2 with regards to antibodies. Let me quickly go to Lynette Kamadi, who's the Executive Secretary, CUPET, from Mombasa. Lynette, I understand you're going to receive your vaccine on Tuesday. At a personal level, and from the teachers that you're interacting with from Mombasa, what are your concerns and what do you expect?
Thank you, Dennis. As a teacher, I have my personal concerns and concerns of my fellow colleagues about the safety of the vaccine. Going by the side effects that we are hearing about, nobody is coming out very clearly to explain this issue of blood clots. It is actually not, whenever we ask about it, it is brushed aside. But as a teacher and the entire teaching fraternity, we are asking the medical practitioners to honestly tell us, why has AstraZeneca been suspended in other countries? Why is it that it is associated with blood clots? And why is it that in other countries it is not being allowed to be given to people below 58 years of age? And while in Kenya, we are asking every other person to go for this vaccine. So that is part of the concerns. Another thing we are concerned about is the other side effects like the headache, the fever, the joint pains, the thirst that somebody goes through. And then there are some people among the teachers who have gotten the jab. Some were even complaining that they were feeling like they are losing their memory. We are asking, who is there following out on these side effects, and where do we go to be given explanation? I think, Dennis, what is the problem that is facing Kenya is communication. Communication does not come properly and accurately as we expect. So it comes in piecemeal, giving room for a lot of rumor and a lot of speculations and conspiracy theories, which becomes a hindrance to people undertaking or listening to the experts as it is supposed to be. So we are concerned about how communication is given and how people are clarifying about the very serious side effects, especially the blood clot issues. Thank you.
Thank you so much, Lynette. Let me go quickly to Celestine before we take a break. Celestine, are these the same concerns that you also have, or what are the issues that you'd want to raise concerning this vaccine program?
Yeah, my concern is now for us who do not fall in either category, that the essential services like the medical personnel, the doctors, the teachers, and people above 58. Now those of us who are below, below 40, we are business people, we are here and there, and we are willing to take this vaccine, and it is not available for us. Now what happens to us? And again, when is the second batch coming? Because, all of us want this vaccine, and the government has not told us exactly when it's coming and how many, doses. And another thing is, they said also they don't vaccinate the pregnant women and the children. What happens to their, some of them are at a high risk. What happens to them? Another thing is, we have been told there are so many variants right now. The virus has mutated and there are so many variants. I want to ask the doctors, is this AstraZeneca able to fight against these variants that are mutating? Because maybe we are told COVID is different today from, the way it came. What happens? And I want to know, as a Kenyan and a person who is not a medical personnel, if maybe you're not sure that you are COVID positive and you go for your vaccine, what happens if you're an active case? Is there any precautions you should take? Are you supposed to be tested first before you take the vaccine? Or what happens? Another question is, what happens, let's say you have been vaccinated. Are you sure, or is it true that you're not able to infect others? I'll take that for now.
Well, thank you so much, Celestine Lagarde. I'm seeing the two doctors busy scribbling and noting those questions down, quite a lot of questions. And these questions that, Lynette and Celestine have asked sums up a lot of the questions that we've been receiving from you as our viewer. And we will take a short break. When we come back, we'll allow Dr. Willis Akwale and Dr. Githinji to answer those same questions. We'll be right back. Stay with us.